Thank you, Senator Chambliss. My name is Rich Huddleston. I'm with Arkansas Advocates for Children and Families. We're a nonprofit, nonpartisan child advocacy organization. Our mission is to ensure that all children and families have the resources and opportunities they need to lead healthy and productive lives and realize their full potential. Even though she's out of the room, I did want to congratulate Madam Chairman Lincoln for taking over the reins of this committee and to say how proud we are back home that I'd have such a strong leader in helping vulnerable children and families. Let me start by painting a picture of poverty in Arkansas. 1 in 4 Arkansas children is poor. Arkansas ranks among the 4 worst states nationally. And
She's
overall
back now, so you can say nice things about her again.
Arkansas ranks among the 4 worst states nationally in overall poverty, with roughly 1 in 6 residents living in poverty. No matter how hard they work, fully half of all Arkansans don't make enough to fully support themselves, and the current economic crisis is not making things any easier. Nationally, about 6 million households with children struggle against hunger. Children in these households also tend to have poor health outcomes and face barriers which make it difficult for them to succeed in school and become productive workers and adults. One of the best things Congress can do to support struggling children is to strengthen the child nutrition programs when it reauthorizes them this year. These programs have extraordinary reach. More than 31 million children eat a meal provided through the school lunch program on a typical day. By providing nutritious meals to children and making it easier for low-income families to make ends meet, the school meals programs reduce poverty and food insecurity and shrink the educational achievement gap for our most disadvantaged children. Unfortunately, millions of children who qualify for free school meals don't receive them. When Congress reauthorized the child nutrition programs in 2004, it required school districts to use direct certification to automatically enroll children, school-age children, in households that receive food stamps. But not all districts conduct direct certification equally effectively. USDA estimates that 3.5 million out of the 10 million children who are eligible for direct certification at the start of the 08-09 school year weren't directly certified. Our goal should be to automatically enroll every single child who is eligible for free meals in a timely manner. Working toward this goal will bring about 3 important benefits. First, needy children will get the food they need and their parents won't have to complete duplicate paperwork. Second, program integrity will be strengthened as schools rely on data that have already been scrubbed by other means-tested programs instead of the paper-based applications that are prone to errors. This will help ensure that taxpayer dollars are spent wisely. Third, schools will have a lower administrative burden, which will free up resources they can use to provide healthier meals or to enrich academic opportunities. I'm going to discuss 2 ways in which Congress can improve access to free school meals. The first is to allow schools with large concentrations of poor students to serve free meals to all of their students rather than spend time identifying the very small number who don't qualify. The school's federal reimbursements would be based on the results of direct certification. If a school directly certifies more than 40% of its students, generally more than 80% of its students qualify for free or reduced meals anyway. So if the school agrees to serve all meals free, it shouldn't have to process applications or check eligibility in the cafeteria. Nationwide, 6 million children attend schools where more than 80% of the students qualify for free or reduced meals. The Senate bill that includes this proposal is entitled the Hunger Free Schools Act. These schools would be literally hunger-free spaces. All children would be eligible to eat breakfast and lunch free of charge. Congress, in short, would eliminate administrative hurdles that get in the way of effectively feeding poor children. The other way in which Congress can improve access to free school meals is by allowing schools to automatically enroll in free meals any student receiving Medicaid. This would help ensure that the poorest children receive free meals regardless of where they attend school. Children in households receiving food stamps have long been eligible for free school meals. This makes sense, since these families have already proven that they have low incomes through the rigorous food stamp enrollment process. The same is true for parents who have enrolled their children in Medicaid. They shouldn't have to complete a duplicative application for school meals, and schools shouldn't have to process unnecessary paperwork. Congress should permit school systems and states to work directly with Medicaid agencies to use income data from Medicaid to automatically enroll children for free school meals. An estimated 2 million poor children participate in Medicaid but not food stamps. In conclusion, I know the committee has received many proposals as part of this reauthorization process, but I believe the two proposals I've described today offer a big bang for the buck and thus deserve high priority. Thank you again for allowing me the opportunity to